Which of the following is the primary goal of nursing? Option A, diagnosis of disease. Option B, promotion of health, prevention of illness, and care of sick. Option C, performing surgeries. Option D, prescribing medications. The correct answer is option B, nursing. Option B, promotion of health, prevention of illness, and care of sick. Nursing focuses on promoting health, preventing illness, and care for the sick, not diagnosing or prescribing. Who defined nursing as the activities required to assist individuals, sick or well, in the performance of those activities contributing to health? Option A, Florence Nightingale. Option B, Virginia Henderson. Option C, Dorothea Oram. Option D, Hilgard Pepla. The correct option is B, Virginia Henderson defined nursing as assisting individuals in activities that contribute to health or recovery. The first step in the nursing process is option A, planning. Option B, assessment. Option C, evaluation. Option D, implementation. The correct answer is option B, assessment. Assessment is the initial step where the nurse collects patient's data. The first step in nursing process is option B, assessment. Is the initial step where the nurse collects patient data. Standard precautions in nursing include option A, only hand hygiene. Option B, use of personal protective equipment, hand hygiene, safe handling of shots. Option C, isolation only. Option D, prescribing antibiotics. The correct answer is option B, use of personal protective equipment, hand hygiene, safe handling of shots. Standard precautions include hand hygiene, PPE, personal protective equipment, and safe handling of shots to prevent infections. What is the ideal temperature range for hospital laundry? Option A, 30 to 40 degrees Celsius. Option B, 60 to 90 degrees Celsius. Option C, 20 to 25 degrees Celsius. Option D, 100 degrees Celsius. The correct answer is option B, 60 to 90 degrees Celsius. Hot water at 60 to 90 degrees Celsius is used effectively kill pathogens in hospital laundry. And hygiene is most effective when option A, hands are visibly dirty. Option B, using plain water only. Option C, use soap and water or alcohol based sanitizer. Option D, wearing gloves. The correct answer is option C, using soap and water or alcohol based sanitizer. Proper hand hygiene involves washing with soap or water or using alcohol sanitizer even when gloves are used. Hand hygiene is most effective when using soap and water or alcohol based. Which of the following is an example of secondary prevention? Option A, vaccination. Option B, screening for hypertension. Option C, healthy diet counseling. Option D, rehabilitation. The correct answer is option B, screening for hypertension. Secondary prevention focuses on early detection and promote treatment like screening programs. The following is an example of secondary prevention. Documentation in nursing is important because option A, it replaces verbal communication. Option B, it is legal record, support continuity of care. Option C, it avoids patient interaction. Option D, it is optional. The correct answer is option B, it is legal record, supports continuity of care. Proper documentation is legal evidence and ensures continuity and quality of care. Nightingale environmental theory emphasizes option A, nurse patient communication. Option B, environmental factors affecting health, example sanitation, light, ventilation. Option C, psychotherapy. Option D, medication adherence. The correct answer is option B, environmental factors affecting health, example sanitation, light, ventilation. Florence Nightingale stressed the impact of environment on health. The term patient centered care refers to option A, focusing on the disease only. Option B, individualized care respecting patient preferences. Option C, following doctor's orders only. Option D, hospital administration task. The correct answer is option B, individualized care respecting patient preferences. Patient-centered care ensures care is tailored to patient needs and values. The term patient-centered care refers to individualized care respecting patient interest. Advocacy in nursing means option A, promoting only hospital policy. Option B, supporting patient right and interest. Option C, ignoring patient concerns. Option D, performing invasive procedures. The correct answer is option B, supporting patient rights and interest. Nurses act as advocates for patients, protecting their rights and ensuring informed decisions. Advocacy in nursing means protecting patients' rights. Critical thinking in nursing involves option A, following routine blindly. Option B, analyzing, evaluating, applying knowledge to patient care. Option C, memorizing textbooks. Option D, delegating all tasks. The correct answer is option B, analyzing, evaluating, and applying knowledge to patient care. Critical thinking allows nurses to make informed clinical decisions. Critical thinking allows nurses to make informed clinical decisions. A nurse notices a coworker breaching infection control. The best action is option A, ignore it. Option B, report to supervisor or follow hospital policy. Option C, confront patient. Option D, leave the workplace. Leave the workplace. The correct answer is option B, report to the supervisor or follow hospital policy. The correct answer is option B, report to the supervisor or follow hospital policy. The primary purpose of infection control committee is option A, perform surgeries. Option B, reduce hospital acquired infections. Option C, conduct research only. Option D, monitor staff attendance. The correct answer is option B, reduce hospital acquired infections. Infection control committees aim to prevent and reduce nosocomial infections. The primary purpose of infection control committees reduce hospital acquired infections. The ABCDE approach in emergency nursing stands for option A, airway, breathing, circulation, disability, exposure. Option B, assessment, breathing, care, diagnosis, evaluation. Option C, airway, blood, circulation, drugs, environment. Option D, none of the above. The correct answer is option A, airway, breathing, circulation, disability, exposure. ABCDE is the systematic approach for assessing critical. The most common cause of myocardial infarction is option A, viral infection. Option B, atherosclerosis of coronary arteries. Option C, trauma. Option D, bacterial infection. The correct answer is option B, atherosclerosis of coronary artery. Myocardial infarction typically occurs due to blockage of coronary artery by atherosclerotic plaques. A patient with COPD is likely to show option A, hypocapnia and hyperventilation. Option B, dyspnea, chronic cough and clubbing. Option C, bradycardia only. Option D, jaundice. The correct answer is option B, dyspnea, chronic cough and clubbing. COPD manifests with the chronic cough, shortness of breath, and digital clubbing due to hypoxia. What is the primary nursing intervention for postoperative pain? Option A, immobilization. Option B, pain assessment and administration of analgesics as prescribed. Option C, encouraging fasting. Option D, ignoring complaints. The correct answer is option B, pain assessment and administration of analgesics as prescribed. Pain should be assessed regularly and analgesics given timely to promote recovery and comfort. Hypertension is defined as blood pressure greater than option A, 120 by 80 mm of Hg. Option B, 130 by 85 mm of Hg. Option C 140 by 90 mm of Hg. Option D 150 by 95 mm of Hg. The correct answer is option C 140 by 90 mm of Hg. Hypertension is generally considered above 140 by 90 mm of Hg in adults. The classic sign of pneumothorax is option A productive cough, option B sudden unilateral chest pain with dyspnea, option C fever, option D bilateral edema. The correct answer is option B sudden unilateral chest pain with dyspnea. Pneumothorax present with sudden chest pain, shortness of breath and decreased breath sounds on one side. Which of the following is a symptom of hypoglycemia? Option A polyuria, option B tremors, sweating, confusion, option C hypertension, option D jaundice. The correct answer is option B tremors, sweating, confusion. Hypoglycemia leads to adrenergic and neuroglycopenic symptoms such as tremors, sweating, and confusion. The nurse should monitor for which complication in patients on long-term corticosteroids. The correct answer is osteoporosis. Option A osteoporosis and hyperglycemia. Option B hypoglycemia. Option C bradycardia. Option D hypertension. The correct answer is option A osteoporosis and hyperglycemia. Long-term corticosteroids use increased risk of osteoporosis, hyperglycemia, and immunosuppression. A patient with renal failure is at risk of option A hyperkalemia, option B hypokalemia, option C hypernatremia, option D anemia. The correct answer is option A hyperkalemia. Impaired renal excretion leads to potassium retention causing hyperkalemia. The first sign of shock is option A hypotension, option B tachycardia, option C bradycardia, option C cyanosis. The correct answer is option B tachycardia. Tachycardia is an early compensatory mechanism in shock. Hypotension occurs later. The first sign of shock is option B tachycardia is an early compensatory mechanism in shock. Hypotension occurs later. In a patient with pneumonia, the expected lung auscultation findings include option A wheezes, crackles, option B absent breath sounds, option D stridor, option D clear breath sounds. The correct answer is option A wheezes, crackles. Pneumonia causes alveolar exudates producing crackles and sometimes wheezes. Pneumonia causes alveolar exudates producing crackles and sometimes wheezes. The priority nursing intervention for a patient with acute asthma attack is option A administer bronchodilators, option B provide high calorie diet, option C encourage bed rest only, option D administer antibiotics. The correct answer is option A administer bronchodilators. Bronchodilators relieve bronchospasm, improving oxygenated in acute asthma. The priority nursing intervention. Which lab test is most specific for diagnosing acute myocardial infarction? Which lab test is most specific for diagnosing acute myocardial infarction? The correct answer is option B, troponin 1. Troponin 1 or T is a highly specific and sensitive for myocardial injury. Troponin 1 is highly specific and sensitive for myocardial injury. Patients with peptic ulcer disease should avoid option A spicy foods, NS non-steroid anti-inflammatory drugs, caffeine, option B protein rich diet, option C vegetables, option D water. The correct answer is option A irritants like Non-steroid anti-inflammatory drugs, spicy foods, and caffeine exacerbate ulcer symptoms. In case of acute heart failure, the first nursing action is option A, administer diuretics and oxygen as prescribed. Option B, encourage walking. Option C, administer non-steroid anti-inflammatory drugs. Option D, provide high salt diet. The correct answer is option A, administer diuretics and oxygen as prescribed. Oxygen and diuretics reduce pulmonary congestion and improve oxygenation. Patient on hemodialysis should be monitored for option A, hypotension, cramps, bleeding. Option B, hyperglycemia. Option C, tachycardia only. Option D, constipation. The correct answer is option A, hypotension, cramps, bleeding. Common complications of dialysis include hypotension, muscle cramps, and bleeding tendencies. Patient on hemodialysis should be monitored for hypotension, cramps, bleeding. Signs of hyponatremia include option A, confusion, lethargy, seizures. Option B, hypertension. Option C, tachypnea. Option D, jaundice. The correct answer is option A, confusion, lethargy, seizures. Low sodium affects neurological function leading to confusion and seizures. Low sodium affects neurological function leading to confusion and seizures. Priority nursing intervention for patient with severe anemia. Option A, administer iron supplements and monitor hemoglobin. Option B, restrict fluids. Option C, provide high fat diet. Option D, encourage heavy exercise. The correct answer is option A, administer iron supplements and monitor hemoglobin. Correcting anemia improves oxygen carrying capacity and prevents complication. Correcting anemia improves oxygen carrying capacity and prevent deep vein thrombosis. Prevention in immobile patients include option A, early ambulation, compression stockings, hydration. Option B, bed rest only. Option C, restrict fluids. Option D, high fat diet. The correct answer is option A, early ambulation, compression stockings, hydration. Movement mechanism compression, mechanical compression and hydration reduce venous stasis and clot formation. Deep vein thrombosis prevention in a mobile patient includes early ambulation, compression stocking. In patients with liver cirrhosis, which dietary recommendation is appropriate? Option A, low sodium, moderate protein diet. Option B, high salt, high protein diet. Option C, low calorie diet only. Option D, fasting. The correct answer is option A, low sodium, moderate protein diet. Reducing sodium helps control edema and ascites. Moderate protein prevents hepatic encephalopathy. Priority nursing action in case of severe burns. Option A, assess airway breathing and circulation. Option B, give oral fluids only. Option C, apply ice directly. Option D, perform physiotherapy first. The correct answer is option A, assess airway breathing and circulation. ABC assessment is a critical in burn patient to prevent life-threatening complications. The normal duration of pregnancy is option A, 36 weeks. Option B, 38 weeks. Option C, 40 weeks. Option D, 42 weeks. The correct answer is option C, 40 weeks. Full-term pregnancy is considered 40 weeks for the first day of the last menstrual period. The normal duration of pregnancy is 40 weeks. The first sign of labor is usually option A, backache and uterine contractions. Option B, vaginal bleeding. Option C, severe headache. Option D, fever. The correct answer is option A, backache and uterine contractions. Labor often begins with regular uterine contractions and lower back pain. The first sign of labor is backache and uterine contractions. The purpose of amniotic fluid assessment is option may determine fetal gender, option B evaluate fetal well-being and detect abnormalities, option C assess maternal nutrition, option D check maternal blood sugar. The correct answer is option B evaluate fetal well-being and detect abnormalities. Amniotic fluid assessment help evaluate fetal health and detect problems like oligohydramnios. A nurse counseling a pregnant woman about iron supplements should include option A take on an empty stomach with water or vitamin C, option B avoid supplements completely, option C take with milk only, option D take before bedtime without water. The correct answer is option A take on empty stomach with water or vitamin C. Vitamin C improves iron absorption. Iron should not be taken with milk or tea. The most common cause of postpartum hemorrhage is option A uterine atony, option B vaginal trauma, option C coagulation disorder, option D infection. The correct answer is option A uterine atony. Uterine atony, failure of the uterus to contract, it is a leading cause of postpartum hemorrhage. The postpartum hemorrhage common cause is uterine atony. Apgar score at 1 minute assess. Option A long-term development, option B immediate adaptation to extrauterine life, option C maternal health, option D placental function. The correct answer is option B immediate adaptation to extrauterine life. The Apgar score evaluates newborn's heart rate, respiration, muscle tone, reflex response and color immediately after birth. Which of the following is a sign of preeclampsia? Option A proteinuria, hypertension, edema, option B fever and chills, option C polyuria, option D hypotension. The correct answer is option A proteinuria, hypertension, edema. Preeclampsia is characterized by high blood pressure, proteinuria and edema during pregnancy. Preeclampsia is characterized by high blood pressure, proteinuria and edema during pregnancy. During labor, the latent phase of first stage is characterized by option A mild to moderate contractions, cervical dilation 0 to 4 cm, strong contractions, cervical dilation 8 to 10 cm. Delivery of the placenta, option D recovery of the mother. The correct answer is option A mild to moderate contraction, cervical dilation 0 to 4 cm. Latent phase involves early cervical dilation and irregular contractions. During labor, the latent phase of the first stage is characterized by which contraceptive method provides protection against sexual transmitted diseases? The correct answer is option A oral contraceptives, option B condoms, option C intrauterine device, option D tubal ligation. The correct answer is option B condoms. Only barrier method like condoms protect against sexual transmitted infections. RH incompatibility can lead to option A hemolytic disease of the newborn, option B maternal diabetes, option C preterm labor only, option D preeclampsia. The correct answer is option A hemolytic disease of the newborn. Rh negative mother with a Rh positive fetus can develop antibodies leading to hemolytic disease in newborn. Rh negative mother with a Rh positive fetus can develop antibodies leading to hemolytic disease in newborn. The normal fetal rate is option A 90 to 110 beats per minute, option B 110 to 160 beats per minute, option C 170 to 190 beats per minute, option D 200 to 220 beats per minute. The correct answer is option B 110 to 160 beats per minute. Normal fetal heart rate ranges from 110 to 160 beats per minute. 110 to 160 beats per minute is a normal fetal heart rate. Breast engorgement can be relieved by option A, frequent breastfeeding and warm compress. Option B, avoiding breastfeeding. Option C, cold packs only. Option D, restricting fluids. The correct answer is option A, frequent breastfeeding and warm compresses. Frequent feeding and warm compresses help reducing engorgement and improves milk flow. Frequent feeding and warm compresses help reduce engorgement and improve milk flow. A newborn is considered preterm if born before option A 36 weeks, option B 37 weeks, option C 38 weeks, option D 39 weeks. The correct answer is option B 37 weeks. Preterm is defined as birth before 37 completed weeks of gestation. A newborn is considered preterm if born before 37 weeks. The primary purpose of fetal monitoring during labor is to option A predict maternal mood, option B assess fetal well-being and detect distress, option C calculate labor duration, option D monitor maternal BP only. Option B, the correct answer is option B assess fetal well-being and detect distress. Fetal monitoring detects heart rate patterns indicating fetal hypoxia or distress. The first action in case of postpartum hemorrhage is option A, massage the uterus and call for help. Option B, administer antibiotics. Option C, encourage ambulation. Option C, provide food. The correct answer is option A, massage the uterus and call for help. Uterine massage stimulates contraction and help control bleeding. Promote intervention is critical. The first action in case of postpartum hemorrhage is uterine massage. The normal respiratory rate for a newborn is option A 20 to 30 breaths per minute, option B 30 to 60 breaths per minute, option C 40 to 70 breaths per minute, option D 10 to 20 breaths per minute. The correct answer is option B 30 to 60 breaths per minute. Newborn normally breathes 30 to 60 times per minute. Higher rates may indicate distress. A common sign of dehydration in infant is option A sunken fontanelle, dry mucous membrane, decreased urine output. Option B excessive salivation. Option C bradycardia. Option D edema. The correct answer is option A sunken fontanelle, dry mucous membrane, decreased urine output. Dehydration in infant present with sunken soft spot, dry mouth, and reduced urination. The primary immunization for preventing tuberculosis in newborn is option A BCG vaccine, option B OPV, oral polio vaccine, option C DPT, option C hepatitis B. The correct answer is option A BCG. BCG vaccine is given at birth to prevent severe forms of tuberculosis. Primary immunization for preventing tuberculosis in newborn is BCG vaccine. Disease in children is characterized by option A fever, rash, conjunctivitis, strawberry tongue, option B jaundice, option D seizures. The correct answer is option A. Kawasaki disease present with prolonged fever, rash, mucous membrane changes and risk of coronary artery aneurysm. A child with acute diarrhea should be given option A oral rehydration solution, option B only water, option C high sugar drinks, option D carbonated beverages. The correct answer is option A oral rehydration solution ORS. ORS replenishes lost fluid and electrolytes, preventing dehydration. Which of the following is a sign of respiratory distress in infant? Option A, nasal flaring, grunting, retractions. Option B, normal crying. Option C, sleeping peacefully. Option D, smooth breathing. The correct answer is option A, nasal flaring, grunting, retractions. Nasal flaring, grunting, and intercostal retractions indicate difficulty in breathing. The normal pulse rate for a 1-year-old child is option A, 60 to 80 beats per minute. Option B, 80 to 120 beats per minute. Option C, 100 to 160 beats per minute. Option D, 40 to 60 beats per minute. The correct answer is option C, 100 to 160 beats per minute. Normal pulse for a 1-year old is 100 to 160 beats per minute. The best way to administer medication to infant is use an oral syringe and small amount at a time. Option B, mix with the formula in large amounts. Option C, forcefully pour it into the mouth. Option D, avoid medication. The correct answer is option A. Use an oral syringe and small amount at a time. Small doses using oral syringe reduce choking and ensures proper absorption. The most common cause of neonatal jaundice is option A, physiological breakdown of fetal hemoglobin. Option B, liver failure only. Option C, infection. Option D, heart disease. The correct answer is option A, physiological breakdown of fetal hemoglobin. Physiological jaundice occur due to immature liver and breakdown of fetal herbaceous. A child with chickenpox should be option A is isolated, given symptomatic care and encouraged not to scratch. Option B, exposed to other children. Option C, given high sugar diet. Option D, forced to bath in hot water. The correct answer is option A, isolated, given symptomatic care and encouraged not to scratch. Isolation prevents symptomatic treatment and preventing scratching reduce complication. Primary health care was first defined in option A, 1978 Alma Ata Declaration, in 1985 Ottawa Charter. Option C, 1990 WHO Conference. Option D, in 2000 Millennium Summit. The correct answer is option A, 1978 Alma Ata Declaration. Emphasized universal access to primary health care. Which of the following is an example of primary prevention? Option A, vaccination. Option B, screening for diabetes. Option C, rehabilitation after stroke. Option D, surgery. The correct answer is option A, vaccination. Primary prevention aims to prevent diseases before it occurs, such as immunization. Which of the following the most common vector for malaria transmission is? Option A, Aedes mosquito. Option D, Anopheles mosquito. Option C, Culex mosquito. Option D, sandfly. The correct answer is option B, Anopheles mosquito. Anopheles mosquito transmit Plasmodium parasite causing malaria. Which nutrient deficiency causes goiter? Option A, iron. Option B, iodine. Option C, vitamin A. Option D, calcium. The correct answer is option B, iodine. Iodine deficiency lead to thyroid enlargement causing goiter. Iron Iodine deficiency leads to thyroid enlargement causing goiter. The main goal of school health program is option A, promote health and prevent diseases among children. Option B, only treat illnesses. Option C, focus on teachers' health. Option D, conduct exams. The correct answer is option A, promote health and prevent disease among children. School health programs are focused on health promotion, disease prevention, and healthy growth of children. The best strategies to control tuberculosis in a community is option A, directly observe treatment short course. Option B, mass antibiotics without monitoring. Option C, isolate all patients. Option D, vaccinate adults only. The correct answer is option A, directly observe treatment short course. DOTS ensures compliance and reduces drug resistance in TB management. Environmental sanitation include option A, safe water, proper sewage disposal, waste management. Option B, only hand washing. Option C, prescribing medication. Option D, hospital based care. The correct answer is option A, safe water, proper sewage disposal, waste management. Environmental sanitation prevents communicable diseases by maintaining hygiene and safety. Which of the following is an example of tertiary prevention? Option A, rehabilitation after stroke. Option B, vaccination. Option C, health education. Option D, screening for hypertension. The correct answer is option A, rehabilitation after stroke. Tertiary prevention reduces complication and disability in already diagnosed diseases. Immunization against polio is given in India as option A, oral polio vaccine and inactivated polio vaccine. Option B, only oral polio vaccine. Option C, only inactivated polio vaccine. Option D, BCG. The correct answer is option A, OPV and IPV. Both oral polio vaccine and inactivated polio vaccine are used in the national immunization schedule. The purpose of family planning program is option A, promote reproductive health, spacing of birth, reduce maternal and infant mortality. Option B, restrict women rights. Option C, increase fertility. Option D, focus only on men. The correct answer is option A, promote reproductive health, spacing of birth, reduce maternal and infant mortality. Family planning help manage population growth, improve maternal child health, and ensure spacing of pregnancies. The primary feature of major depressive disorder is option A, persistent sadness and loss of interest in daily activities. Option B, hallucinations and delusions. Option C, sudden euphoria. Option D, aggression only. The correct answer is option A, persistent sadness and loss of interest in daily activities. Major depression presents with prolonged low mood, loss of pleasure, and functional impairment. Which of the following is a common side effect of antipsychotic medication? The correct answer is option A. Extrapyramidal symptoms like tremors and rigidity. Antipsychotic, especially typically ones, can cause extrapyramidal symptoms including tremors, rigidity, and tardive dyskinesia. Common side effect of antipsychotic medication is extrapyramidal symptoms like tremors, rigidity, and tardive dyskinesia. The best approach for managing a patient with anxiety is option A, cognitive behavioral therapy and relaxation techniques. Option B, ignoring the patient. Option C, sedation without therapy. Option D, hospitalization only. The correct answer is option A, cognitive behavioral therapy and relaxation technique. Cognitive behavioral therapy and relaxation strategies help patients manage anxiety effectively. A patient with schizophrenia may present with option A, hallucinations, delusions, social withdrawal. Option B, fever and cough. Option C, increased appetite only. Option D, hypertension. The correct answer is hallucinations, delusions, social withdrawal. Schizophrenia involves positive symptoms, hallucinations, delusions, and negative symptoms, social withdrawal. Suicide risk assessment includes evaluating option A, addition, plan, means, and previous attempts. Option B, blood pressure only. Option C, appetite. Option D, sleep patterns only. The correct answer is option A. Assessing risk involves understanding the plans, assess to means, and past attempts. Suicide risk assessment include evaluating ideation, plans, means, and previous attempts. The most common psychiatric disorder in children is option A, attention deficit hyperactivity disorder. Option B, schizophrenia. Option C, bipolar disorder. Option D, dementia. The correct answer is option A, ADHD. ADHD is common in children characterized by inattention, hyperactivity, and impulsivity. Most common psychiatric disorder in children is AD. The patients with Alzheimer's disease nursing intervention include option A, orientation, safety measures, structure, routine. Option B, allowing unsupervised wandering. Option C, restricting communication. Option D, ignoring cognitive decline. The correct answer is option A, orientation, safety measures, structured routine. Structured routines, cognitive support, and safety are key nursing interventions for Alzheimer's patients. Structured routines, cognitive support, and safety are key nursing interventions for Alzheimer's patients. The primary purpose of psychiatric rehabilitation is option A, helping patients regain social, vocational, and daily functioning. Option B, only provide medication. Option C, isolate the patient. Option D, perform surgical intervention. The correct answer is option A, helping patient regain social, vocational, and daily functioning. Rehabilitation focus on recovery, social reintegration, and improving quality of life. Mania in bipolar disorder is characterized by option A, elevated mood, increased activity, decreased need for sleep. Option B, depressed mood. Option C, hallucination. Option D, hypertension. The correct answer is option A, elevated mood, increased activity, decreased need for sleep. Manic episodes involve hyperactivity, euphoria, and reduced sleep, often with risky behavior. Mania in bipolar disorder is characterized by elevated mood, increased activity. The first line medication for anxiety disorder is option A, selective serotonin reuptake inhibitor. Option B, antibiotics. Option C, non-steroid anti-inflammatory drugs. Option D, antihypertensives. The correct answer is option A. Selective serotonin reuptake inhibitor are commonly prescribed to manage anxiety due to efficacy and safety profile. The antibiotic of choice for pneumococcal infection is option A, penicillin. Option B, ciprofloxacin. Option C, erythromycin only. Option D, tetracycline. The correct answer is option A, penicillin. Penicillin remains the first line treatment for streptococcus pneumoniae infections unless resistance is present. The antibiotic of choice for pneumococcal infection is option A, penicillin. Which drug is used as an antidote for opioid overdose? Option A, naloxone. Option B, atropine. Option C, epinephrine. Option D, diazepam. The correct answer is option A, naloxone. Naloxone reverses opioid effects by competitive antagonism at opioid receptors. Common side effect of loop diuretics is option A, hypokalemia. Option B, hyperkalemia. Option C, hypertension. Option D, bradycardia. The correct answer is option hypokalemia. Loop diuresis increases renal potassium excretion, leading to hypokalemia. Common side effect of took diuretics is hypokalemia. A patient with hypothyroidism is prescribed option A methimazole, option B levothyroxine, option C insulin, option D prednisone. The correct answer is option A methimazole. Methimazole inhibits thyroid hormone synthesis to manage hypothyroidism. A patient with hypothyroidism is prescribed option A methimazole. Which of the following drug is used for acute anaphylaxis? Option A epinephrine, option B ibuprofen, option C ethanol, option D amoxicillin. The correct answer is option A epinephrine. Epinephrine is the first line treatment for severe allergic reactions. The anticoagulant used in initial management of deep vein thrombosis. Option A heparin, option B warfarin, option C aspirin, option D. The correct answer is option A heparin. Quickly to prevent clot propagation, warfarin is used for long-term management. A common side effect of ACE inhibitors is option A dry cough, option B diarrhea, option C bradycardia, option C insomnia. The correct answer is option A dry cough. ACE inhibitors increase bradykinin levels, causing persistent cough in some patients. A common side effect of ACE inhibitors is option A dry cough. The drug of choice for type 2 diabetes management is option A metformin, option B insulin only, option C sulfonylureas only, option D prednisone. The correct answer is option A metformin. Metformin improves insulin sensitivity and is first line for type 2 diabetes unless contraindicated. Which of the following is used to treat hyperkalemia? Option A calcium gluconate insulin with glucose, option B potassium supplement, option C non-steroidal anti-inflammatory drugs, option D ACE inhibitors. The correct answer is option A calcium gluconate insulin with glucose. Calcium stabilizes cardiac membranes. Insulin derives potassium into cells, lowering serum levels. The class of drugs used to treat hypertension and heart failure is option A ACE inhibitor, option B antibiotics, option C analgesics, option D antihistamines. The correct answer is option A ACE inhibitors. ACE inhibitors reduces afterload and improve survival in hypertension and heart failure patients. The class of drugs used to treat hypertension and treat heart failure is option A ACE inhibitors. Which vitamin is essential for blood clotting? Option A vitamin K, option B vitamin C, option C vitamin A, option D vitamin D. The correct answer is option A vitamin K. Vitamin K is required for synthesis of clotting factors in the liver. Vitamin essential for blood clotting is vitamin K. Iron rich foods include option A spinach, red meat, lentils, option B milk only, option C sugar and candy, option D oil and fats. The correct answer is option A spinach, red meat, lentils. Iron from plants, lentils, spinach and animal sources red meat prevents anemia. Vitamin C is important for option A, collagen synthesis and wound healing. Option B, vision. Option C, bone mineralization. Option D, blood clotting. The correct answer is option A, collagen synthesis and wound healing. Vitamin C is essential for collagen formation, wound healing, and immune function. Vitamin C is important for collagen formation, wound healing, and immune function. Which nutrient is a primary source of energy? Option A, carbohydrates. Option B, vitamins. Option C, minerals. Option D, water. The correct answer is option A, carbohydrates. Carbohydrates are broken down into glucose, providing immediate energy. Which nutrient is a primary source of energy? Option A, carbohydrates. Protein deficiency in children may lead to. Option A, Kwashiorkor. Option B, scurvy. Option C, rickets. Option D, goiter. The correct answer is option A, Kwashiorkor. Protein energy malnutrition causes Kwashiorkor, characterized by edema, fatty liver, and growth retardation. Protein energy malnutrition causes Kwashiorkor, characterized by edema, fatty liver, and growth retardation. The largest organ in the human body is option A, liver. Option B, skin. Option C, heart. Option D, lungs. The correct answer is option B, skin. Skin acts as a protective barrier and is the largest organ by surface area and weight. Largest organ in the human body is skin. Which chamber of the heart pumps blood to the lungs? Option A, right atrium. Option B, right ventricle. Option C, left atrium. Option D, left ventricle. The correct answer is option B, right ventricle. The right ventricle pumps deoxygenated blood into pulmonary artery for oxygenation. Right ventricle pumps deoxygenated blood into pulmonary artery for oxygenation. The function of red blood cells is option A, transport oxygen and carbon dioxide. Option C, fight infections. Option C, clot blood. Option D, store minerals. The correct answer is option A, transport oxygen and carbon dioxide. RBC contains hemoglobin, which carries oxygen to tissues and carbon dioxide back to lungs. RBC contains hemoglobin, which carries oxygen to tissues and carbon dioxide back to lungs. The structure that connects muscle to bone is called option A, ligament. Option B, tendon. Option C, cartilage. Option D, fascia. The correct answer is option B, tendon. Tendons attach muscles to bones, allowing movement. The structure that connects muscle to bone is called option B, tendon. The basic functional unit of kidney is option A, nephron. Option B, glomerulus only. Option C, tubule only. Option D, Bowman's capsule only. The correct answer is option A, nephron. The nephron filters blood, reabsorbs nutrients, and excretes waste to form urine. The basic functional unit of kidney is option A, nephron. Filters blood, reabsorbs nutrients, and excretes waste to form urine. Thank you all.